Hi, my name is Jennifer Salinas. I'm a physician assistant student at the University of Pittsburgh, and today I'll be demonstrating the running subcuticular suture technique. Before I begin, I'll review my supplies. I'll need a needle driver, a tissue forceps with teeth, suture scissors, non-absorbable or absorbable sutures, commonly the monocryl subcuticular closure, a sterile drape, sterile gloves, antiseptic solution, and gauze, a sharp container, and some indications. Indications could be the suture technique is commonly indicated for cosmetic closures after surgical incisions where minimal scarring is desired, clean, linear wound, well approximated edges, and tension. Contradiction would be infection wound where closure can trap bacteria in, or high tension, irregular wound edges that require adequate support. Some complications can include wound dehiscence if tension is not evenly distributed, infection, or abscess formation, especially if the technique is not maintained, sterile technique is not maintained. Next, I'm going to go ahead and walk through sterile technique. So I'll begin by performing hand hygiene, then opening my sterile field with a clean flat surface, making sure the corners are folded away to avoid contaminating the field. I'll open my supplies on the sterile field without reaching across. Then I'll dome my gloves and carefully maintain sterile field. So next, I'm going to actually position my camera down so you guys can see that I've already set up here. Let's do this. Perfect. All right, so first I'm actually going to start off by grasping my needle 2/3 of the way. Oops. And assuming that I have sterile gloves as well. 2/3 of the way, I'm going to go ahead and bring the skin out. Perfect. And I made sure I took my bite 5 millimeters from the wound. And now I'm going to go ahead and turn my needle away from me. And I'm going to come out the opposite edge here. I'm going to push that a little bit through. Perfect. Now I'm going to go ahead and perform my knot. So for my knot, I'm going to be over the wound, doing 2 loops and then crossing over. Again, doing 1, crossing over, doing it again. Perfect. One more time. Awesome. Now I'm going to go ahead and cut the excess string. And what makes it a continuous run is that we don't cut off the end with the needle on it. So next I'm going to move on to perform 6 bites. And I'm going to go ahead and keep them as even as possible here. Perfect. And I'll repeat that on the other side, taking my second bite. And keeping tension as well. Perfect. Now I'm going to move to the opposite side for my third. Moving on to my fourth bite, again keeping that tension because we want the edges to approximate nicely. Now moving on to my 5th bite. And going to my 6th bite. And I will be leaving a little loop here so I can perform the knot tie. Perfect. So now I'm going to go ahead and tie my wound. So 2 knots, and I'm going to grab that loop that was left out. And due to the skin pad, we won't see the nice little closure here. second one. Perfect. And now I'm going to go ahead and cut the excess string off with the needle. Perfect. And then, assuming that I can close all of it, the wound will close nicely. And that completes the demonstration. So I place all my instruments and sharps in the appropriate places and dispose of my needle safely in the sharps container. So this concludes my demonstration of the running subcuticular suture. Throughout the procedure, I maintained sterile field with proper tissue handling and needle control, ensuring that the wound edges are approximated. And thank you so much for watching.